Hi, my name is Dr. Amina. I'm a physician from Pakistan. In Canada, I was thinking that I would start my journey as a health professional where I ended. I did a couple of exams and I've been successful in that exams too, but by the time you completed all the exams, you will be out of practice for 5 or 6 years, and that would be downtime for you to get the residency spot. So before getting another exams or giving another exam after passing 2 exams, I started thinking about the alternative fields. So I found there's a Mishna Health Institute. There's a good program for the diabetes educator program. So I enrolled in that program. I did my 1-year graduate certificate. After the completion of the graduate certificate, there's another challenge, a barrier for me, because I need 800 hours of paid internship to show to the that consult, and they can let me to do my certification examination. And that was at that point nobody can give me. I applied for jobs different, but that diabetes educator job was here for the registered nurse and dietitian. For the foreign health professionals, there is a no job. So I didn't get any job. So what I did, I don't want to lose that knowledge. So what I started doing, I started doing volunteership in the community matters, in the healthy living, because there's a healthy living programs over here. I started volunteering. I started giving the workshops, healthy living workshop, physical activity workshops, do the facilitation. In the meantime, I have other membership of the Young Street Mission as an executive in the Women Council. So I did different programs for the healthy living program, started over there. I did the workshops, and at that point, I got paid for the workshops. And so this is my paid work. Yeah, so I researched on that how to prevent the diabetes in different ethnic groups. What can be the strategies? What can be the recommendations? So I prepared a research paper for that. On the base of that research paper, Community Matter applied for the funding. They got the funding, and then they started diabetes education and diabetes prevention program in the community matters. So that's how I launched my career as a diabetes educator in my own way through the community matters. While doing my this diabetes education facilitation workshops, and at that point of time, the local health integration network started up Health Access in Gemstone project. One of the initiatives of the Health Access in Gemstone was the mobile rental bus. Because before starting or launching this Health Access program project, they did research what the residents need and what they want, what their demands, what they need, what programs they need. So one of the biggest need and what they expressed the residents were through the service, and I was one of the community animator. That was from the public interest. They hired me as an animator, one of the animator. They were hiring different multi-ethnic animators. So I did like the qualitative research. I did surveys and the interviews in my own community and the other communities too. At that point, they need a person who's been resident of this community, who know this neighborhood, who have a good relationship with other organizations and with the residents too, and they are being their neighbor. The community matters and the community corner are two the partner organization in this Health Access in Gemstone. They both nominated me as a point person, as a coordinator for this mobile dental bus. So this is my second breakthrough. At this point, I started my work as a coordinator for the mobile dental bus. It started as a coordinator for the mobile dental, but with the passage of time, it evolved as a coordinator who is just referring the people to different services. At this point, I had an opportunity to interact with the health professionals, to the physicians, to the nurses, to the dietitian. So I have an idea what the Canadian health system is like from inside. Along with that, I start navigating the research part of the healthcare system. So I did some workshop, I attended some workshop from the Health Force Ontario, and there's a peer-to-peer program over there. So there was one researcher from India came, and he gives some tips that how to get some volunteer work from the research. So I attended that workshop, and along with that work, that my work as a hub coordinator and as a dental bus coordinator, I keep on trying to connect with the research field too. To get even a volunteer work was a big job. I had a couple of interviews and I didn't get the job just for the volunteer too. And then after 3 months, I just emailed the principal investigator, this is Dr. Lorraine Lipscomb. I asked her and she said, okay, yeah, now we have a place for the volunteership. So I got the job for the volunteer. And the good thing happened was the hospital, Women's College Hospital, feel that this position is an important position and it should be paid. It should be paid position. It should not be like a volunteer position. So they make it a paid position and they give me a contract till the May. So what's my job is my job title is a research assistant. I'm doing the recruitment for the adaptive study. I'm an employee of Women's College Hospital, but my work is in the Toronto East General Hospital. So right now I'm in Women's College Hospital and the Toronto East General Hospital. I'm doing my work in both hospitals. I think the most important thing, a health professional who come to Canada and want to be in a Canadian healthcare system, perseverance, hard work, believe in yourself, and believe in the God. These are the 4 things which I take with myself, and I keep on working. I never give up. The basic thing is that never give up. There is if you work hard, believe in yourself, if you're working hard, you will get somewhere. Your hard work will never be wasted. This is the one thing which I always have carry with myself, because I know myself. I know my skills. No matter other people do, but I have to show them. If I just give up, how come other people know that I'm good at this thing? So keep on trying, keep on knocking the doors, and believe that one day the door will open. Networking is very important. I found networking is the basic thing you need to develop, you need to have. And other main thing is to get a mentor. Because mentor, the sincere mentor, where you turn to whenever you need help, because this is a new thing for you, new culture, new country, everything is new. You need to learn, like you're reborn. Because you need to learn each and everything again, that how to communicate well according to the Canadian context, how to interact with the people, how to do good communication skills. You need to learn that. How to do a good email, because written and vocal is 2 different things. These are the important skills to develop through your journey. So keep on learning. Never stop at any. If you are not even working, do courses on the communication, how to network, meet people, go to different events, For example, if there is a research, if you want to be a researcher, research what the events are going on, where you can meet the people with the research. Networking is basic. I think the networking helped me a lot to get this position. In my experience, the employers in the Canadian healthcare system are looking for a person who are confident, courageous, and know their field. They know what they are doing. They know where they are going, what they want. This is the basic thing, that if you, for example, if you apply for a researcher job, you should know what your field is all about. My advice for the foreign-trained healthcare professionals while navigating the Canadian health system and writing their exams, do research to the alternative fields. That's a good thing that you will do. What your goal is to get the residency in this system, but at the same time you have a plan B too, that if that thing is not going well, or if there is some challenges or barriers you cannot overcome, there is somewhere else you can go. So along with that, start researching what other alternative fields you can go, and also along with that, do networking in your own field of work where you want to go. Networking is so important, and volunteering. Try to get volunteer work from for example, go to the community health centers and do any not to the specific volunteer job. Like if you get into the system, go to the volunteer work, then you will develop the networking over there. So you never know where you go. The future for the health professionals in the Canadian health system is definitely, the future is there. It's not like that condition that nobody's getting. There's so many doctors you can see in the hospitals. There's so many immigrant doctors are working here. The thing is that you need a real world research. Before starting or navigating, going to any direction, first do the research about that thing, that where you are going, and what you would be there after 1 year, 2 years, or 3 years, or the 5 years. So it's not like the blindly, you cannot just start one thing and start going over that path. No. First you have to research, have references, do volunteer work, do networking, and the future is there for you.